Our starting point is not to find out what works. You've already tested some innovations, and you are at a point of seeing how do we deepen impact or scale it out. So our entry point is tested solutions that can be supported to go further. We're melding implementation, or program implementation, with research.
Currently, we are implementing in 3 districts. And we are taking the model to scale through the Rwandan health system, and we are discussing with the government how can the model can be embedded into the existing health system.
And as we responded to the call, to the IDRC call, we thought, why don't we scale up what the Light Takando is doing in terms of engaging with caregivers, look at the challenges, what are the experiences, what do we need to focus on, maybe in terms of financing, what is the cost of caregiving, and put this into policy, and then scale up that model of caregiving and see how far we get with it.
What we are doing is trying to scale up a successful communal rooftop harvesting system that was tested in Tanzania in 3 villages, and it was successful, so we're trying to scale that up.
And one of the innovations is workload easing by use of donkeys. The other innovation is to challenge the norms.
We will be reviewing the national gender mainstreaming guideline and policy, and we would like to quantify or evaluate the unpaid care domestic work using relevant data, existing secondary data, and complemented by primary data, conduct consultations with policymakers, experts and advocates.
À travers une technologie qu'on appelle le foyer amélioré TICA, réduire donc la difficulté dans l'accomplissement des tâches de ménage, surtout au niveau de la cuisson. Et cette technologie permettra donc non seulement de réduire la difficulté, mais de donner du temps à la femme en milieu rural quand elle revient des champs, de cuire plus vite son repas et de permettre d'avoir également le temps pour pouvoir apprendre autre chose ou faire une activité génératrice de revenus. C'est notre objectif.
Nous allons mettre à échelle une innovation prouvée dans la transformation des normes socioculturelles, prouvée pour la réduction des violences basées sur le genre et aussi pour l'autonomisation de la femme.
We were trying to understand how women's intersecting vulnerabilities, what they are, how they're experienced, and how could we co-create sustainable pathways to improve their quality of life.
Our project objectives include taking a policy approach, because the only way to create sustainable impact is to make systemic changes. And the only way to make a systemic change is to get policy involved.
We don't have a childcare policy here in Kenya, so we're looking to use our data, because we have a wealth of data, to influence policy either on a county level or on a national level. We're very happy to do that.
The role of this project actually is mainly to support, it is not to implement, but to support the scale-up process through capacity building, evidence generation, and fostering institutional coordination and community of practice.
We want to adapt 2 successful models on early childhood development that have been implemented, one of them here in Kenya and another one in Malawi.
Expectations are that if our 24 months is due, we would have improved policy that goes to support caregivers of children with disability.
We're researching whether adding a care work module to this existing curriculum, does it help reduce unpaid care work?
We realize that often there are gatekeepers within the communities, who really want to keep the status quo. So what we want to do is to engage with different stakeholders so that we have a buy-in about this project.
We're engaging traditional religious leaders at the community level, especially in rural areas, to prioritize policies that lessen the burden on women, access to water, health, sanitation, and also primary school provision.
Il y a la politique de la garde d'enfants au Bénin qui est en révision. Cette première politique élaborée n'avait pas du tout pris en compte les femmes du secteur informel. Donc, comment nous faisons avec des plaidoyers, l'engagement politique, pour que désormais, dans la nouvelle politique à élaborer, on puisse avoir un champ pour les femmes du secteur informel, des modèles alternatifs de garde d'enfants.
In 2022, under a different banner, I think in this exact room, we sought to answer the question, why should we care for unpaid care work? Today, in 2024, 2 years later, we convene to discuss how to scale innovations in the care economy in Africa. To me, ladies and gentlemen, that signifies growth by moving conversations from the why, which speaks to importance of prioritizing care work, and now to how, which speaks to appraising progress made in lending support to the care economy.
We have to sensitize the community, the women, that taking their children to a care facility will relieve them from that care work, and they will be able to participate in, for example, starting businesses, which will assist them in their houses and which will empower them.
And policy means nothing if it's not implemented. So then there are some behavioural changes which are necessary for the new policies to be implemented. And quite a lot of implementation science is about that.
We should approach our scaling efforts with what we call a continuous learning mindset that goes beyond asking whether an impact has achieved its intended results, but also asks how and why.
Perhaps you've already worked on a successful intervention that relates to women's economic empowerment, that relates to gender equality, and that has some care impact. But you want to add complementary interventions into it to deepen that positive effect on care.
Care work is work, but we don't tell people what we necessarily want them to do with that information. So it's really important that when we're thinking about our messages, we're thinking about what it is we want people to be doing. There's so many platforms. Don't miss the opportunity because you assume that certain people don't use it.
I think in the last few years, we've really seen care mapped out on the global agenda in a really important way.
We cannot be doing this work without accounting for patriarchy and the long battle it is to fight it.
Framing matters. So you could frame care as care for women's rights or care as an intrinsic important thing in itself.
Government started realizing that look at the time women spend undertaking care work, that they are not remunerated, that is not counted. We then started working on care work.
There are lots of places where I know that all of you will be influential in using your voices, talking about the challenges, talking about the opportunities, and then making it happen.
To the forum and the dialogue we are targeting, we have International Women's Day at the national level. The CSW was listed, but also we have seen the Agenda 2063 specifically for Africa, the Africa we want.
One of the goals we want to achieve through this cohort of projects is to set up a community of practice.
We're hoping you spend about 10 to 15 minutes per question, and we'll be walking in and out between groups, so if you have any questions, you can reach out to us.
So when you're talking about this community of practice, how do you create a profile around it? How do you communicate in a way that people actually want to be involved, or even if they're not directly involved, want to hear what's coming out of your community of practice, that they feel that there's something exciting coming out of that space? And also, how do you ensure that it's introduced in a uniform manner?
There's going to be a lot of publications that are going to come from our various research activities.
Why is project reporting important to us? And I guess also to this group here. Everything that we are doing today and around our grants is very time-based. Effectively, there are critical indicators that have been set in, and these require to be at all points referenced and adhered to. The templates with respect to technical and financial reports are available at this link on our public website.
For me, the biggest takeaway is how brilliant this program is, and I can't wait to see the outcomes in 3 years.
I'm seeing how I can use what I've learned here, even beyond the life of this project. It's been extremely eye-opening. It's amazing the wealth of knowledge that is here in this room.
I realize now how important communication is, the value of storytelling. We use lived experiences a lot, and now I realize that less is actually more.
My focus right now is visual communication in the development space.
We can't wait to hear more about your success so we can continue the communications on that.